We've been nice enough to have Betty allow us to film her today, and we're going to be using a little bit of Dysport. Dysport is our new, I wouldn't quite say the word rival, but it's another product that is Botox in nature. It's an acetylcholine release inhibitor, just like Botox is, and helps us to modify underlying muscle activity. And just as an aside, I think that whether we're using Botox or Dysport, what we're trying to isolate here are what we call the dynamic wrinkles of the face. These are the wrinkles that are caused by the direct activity of underlying muscle activity. And in those particular areas, and if Betty's been nice enough to allow us to mark on her, what we're trying to get is the depressor muscles of the medial brow. These are the corrugator and procerus musculature, and we're also trying to get the lateral or crow's foot area. These are the lateral fibers of the orbicularis muscle. So where we're going to be injecting Betty today is getting a few areas of the orbicularis musculature. This is going to allow us to get a little bit of a reset of the tail of brow position, and we're going to get a little bit of the orbicularis muscle on the opposite side. And then we're going to, with Dysport, the injection locations are slightly different than Botox, and we're going to be giving Betty about 5 injections right in this general kind of a elongated V disposition. And we're going to just rotate the table back a little bit. We'll let you observe us while we inject Betty, and we'll let you see how it's done. So from a procedural standpoint, we inject Dysport very much the same way we do with our previous use of Botox. The volumes of injection are slightly smaller, which from a pain standpoint does provide the patient with a little bit more pain relief. One other aside with regards to using Dysport, if you're calling around to various offices asking about the price point for Dysport, the units of Dysport compared to the units of Botox are really not comparable. So the price point for Dysport is very, very similar to our current Botox pricing, but the number of units per vial is considerably larger for Dysport than it is for traditional Botox. So we're going to go ahead and inject these various area aspects of the medial brow depressor, and so Betty's going to sit there while we go ahead and inject. And we inject about 1/10 of a cc into each of these respective access incisions here. Everybody's technique is going to vary to some degree or another. I'm a big advocate of just gently massaging the Dysport into the tissue. I think, and I've done this for Botox for years, and I think it just does a better job of allowing the product to get into the respective larger muscle bellies a little bit more uniformly and effectively.